probably one of the biggest questions we get. And, I think my audience in some ways is more intelligent than your average bear. I mean, they found their way here, but the headlines are showing us something similar. When we look at the headlines right now, this is what you'll see. 1 in 3, this is Newsweek, 1 in 3 dog owners refuse to vaccinate pets due to conspiracy theory. That was just September 4th, 2023. And so, um, people are starting like I think this whole COVID vaccine thing just it's caused we had Dr. Peter McCullough, doctors, but lay people to say, man, if they were wrong about this and still pushing it, what about the rest of it? And it has us looking at like we give our cats and animals or dogs a lot of vaccines.
Yeah, we sure do. And we start when they're really young. And usually when their immune systems are still maturing at sometimes as young as 4, 5, 6 weeks of age.
Yeah.
And we're giving them repetitive vaccines every 2 to 3 weeks up until they're 4 or 5 months of age. And that's at a point when the immune system is developing, the gut immune system especially. And that's when we see the most damage and sets us up for chronic disease later on in life. And, that's something that I try and, when I counsel clients, I try and tell them that at that age, be mindful of what we're putting into these animals. And if possible, I recommend skipping most of them. I use in my practice homeopathic remedies to help keep animals healthy. And I also use nutritional supplements and herbal therapies. And I try to stay away from outside chemical agents if possible.
Okay.
And vaccines, obviously, are the cornerstone of conventional preventative care. And as I said, as I've had my 30 years experience doing this, I've seen it cause more suffering and immune-mediated diseases than I want to see, and even cancer. So.
Yeah. When you say cancer, and that was one of the things we were talking about bringing you in just a couple months ago. We were just doing like an old dive, and because these questions were coming in, and I saw there was actually so many studies on, in this case, was feline cancer, like these cancers in cats. This is just one of them, vaccine-associated feline sarcomas. And it got really specific. I mean, they started seeing that where they were injecting the cats, the injection sites themselves were developing these tumors, and it just made me think to call you, but there was so much science and they sort of recognized it. And it seems to me that they were more open to removing adjuvants. I think we had one of the ads, like the aluminum and things that we've been trying to get out of the childhood vaccine program. Veterinary medicine, right here, look at this, safety, purity, look, bring that back up really quick, I have right here. Safety, purity, proven protection, PureVac vaccines. Look what it says, PureVac's feline vaccines have been designed to elicit a protective immune response without the addition of adjuvants. They're celebrating that. You'll never see that written on a single childhood vaccine.
No, not at all.
They won't do it. They'll stick with the adjuvants. But here, right, with our animals, we'll go that extra step.
Absolutely. And that was a really good development that the drug companies came up with, was an aluminum, adjuvant-free vaccine.
Yeah.
And, not that there aren't other components in vaccines that cause illness. There are buffers and stabilizers and antibiotics and formaldehyde that are also problematic, but definitely removing the aluminum, which was one of the main immune stimulants and toxins to the nervous system, the heart, the spleen, the liver, and it's actually, the aluminum stays at the site of the vaccine for an extended period of time, therefore causing chronic inflammation and eventually these cancers in cats that were appearing months, if not years later. And initially, before my profession found out that it was aluminum, they were recommending that veterinarians vaccinate animals in the tail or on an extremity, just so that if that would occur, you can easily remove the tail or an extremity, because the fibrosarcomas, which were the cancers that were appearing, were very refractory to conventional medical treatment and would always come back and eventually killed these animals.
Wow. So just instead of stopping the practice, just put it somewhere where we can cut that part of the body off.
Right. But as you said, Del, it is good, and it's a good development. At least it's in the right direction that we remove the aluminum. And even with dogs, there's with rabies vaccine, there are now thimerosal mercury-free vaccines that again are helpful.
Yeah.
But I want to again remind people that there are other components in the vaccines that really shouldn't be in there, and they cause problems as well.
There's a lot of when we talk about, and my wheelhouse is obviously, human vaccines, but this one size fits all
Yes.
idea is really problematic. I mean, whether you have a preemie baby or, like my little brother, I think was 10.5 pounds when he was born, big chunker.
Right.
They're getting the same vaccine dose. And then I think about the amount of vaccines. People will say, well, I got my vaccines. And I was like, yeah, if you were born before 1986, you had maybe, 10 vaccines, really 3 shots given a couple times.
Right.
Your kids are now getting 72 vaccines. Is there a similar thing to the amount of vaccines you're saying over and over we're giving in the first several months? Do you feel it's overkill? I mean, is there?
Absolutely. And now there's more increased use of other vaccines like kennel cough, and influenza vaccine was developed. And
They have a flu shot
they have
for
a flu
animals?
shot for animals now. And most of the boarding and kennel facilities actually are now requiring that for animals to be boarded, or for doggy daycare. So there's definitely been an increase in the number of vaccines. And then you have what are called other non-core vaccines like leptospirosis and Lyme disease. And these other vaccines in most animals are not necessary, and they're not safe. They're very often not effective. And you brought up another good point about the one size fits all. A lot of my colleagues are vaccinating every animal in the same way, just like you said with
Yeah.
kids. They're vaccinating large breed dogs like Labradors and sporting dogs, the same that they would a little Yorkie that may not even go outside very much,
Right.
giving them the same vaccines and the same amounts. And, most of my colleagues are still giving the standard 1 cc dose of a vaccine. And fortunately, one of my colleagues, Dr. Gene Dodd, several years ago, published a nice study that showed that you can get effective, antibody response by using half-dose vaccines. So you're cutting down on the amount of, components of the vaccine that
We got
you're
a
giving.
quote from this study. It says right here, a half dose of this vaccine was given and generated increased serum vaccine antibody titers for all the dogs studied. The median titer and endpoint titer levels had a sustained increase in all dogs at 6 months post-vaccination, as the presence of measurable CPV and CDV serum. What is that? I don't know what that means. Serum antibody
Antibodies, yeah.
titers reflect immunity to these viruses. And given that vaccines are known to cause adverse events, especially in smaller dogs, results of this study confirms that receiving a half dose of bivalent DPV vaccine was efficacious for this study cohort. So it's basically saying that the vaccine is doing its job. Now, a lot of us, by the time we even get our dog, has been vaccinated. I happened to directly buy a dog from a friend recently, so it's the one dog I know that is just, so healthy, didn't vaccinate at all. I suppose someone's going to record this and come knock on my door, but that is the question, right? There's a lot of laws around, getting rabies shots and things like that. And so for people that are struggling in there, and normally I would just say if it's your kid, don't do it.
Right.
Animals, we kind of maybe look at it a different way. What is your advice to people that are, sort of how do they get through the gauntlet? Is there a way to minimize? Can you ask for half doses?
With the rabies vaccine, it's a little bit harder because it's supposed to be a standard 1 cc dose. I, in my practice, often will cut down on it.
Okay.
Because I think you get the same immune response as you would with the full dose. Rabies vaccine is required by law in all 50 states. And I usually tell clients to wait to get the first one until the immune system is a little more mature, until around 6 months of age.
Okay.
That first vaccine is good for 1 year, legally.
Yep.
And then they're given a booster at a year of age that's good for 3 years. Now, that 3-year immunity is an arbitrary cutoff. It really is, the immunity lasts much longer than 3 years. And there was some nice studies done by the Rabies Challenge Fund, which were just completed, where they documented that immunity to rabies vaccine lasts for at least 5 years in these animals. So and rabies vaccine from a holistic perspective is one of the more damaging ones to the immune system. It leads to antibodies against the thyroid gland. I often see it lead to neurologic problems, behavioral issues,
Really?
anxiety, seizures. So it's really one of the more stronger vaccines given to these animals. And even when you remove the adjuvants, the mercury and the aluminum, I still see immune reactions. And that's because it's stimulating an antibody response against the rest of the tissues in the body.
Yeah.
And, that it was a colleague of mine back in the 90s that actually did some work. His name was Dr. Larry Glickman from Purdue University. And he looked at vaccines and whether they caused antibody responses in dogs. And he looked at multivalent, meaning, multiple combination vaccines, which is the typical way my colleagues give them. And he found that the animals that were vaccinated developed antibodies against many proteins and biochemicals in the body, against collagen, which is the main protein in the body, against the albumin, which is another major protein in the body, different connective tissue components, even the heart valves of patients. They developed antibodies against the heart valve. Now, there's a breed, the King Charles Cavalier Spaniel, that's genetically predisposed to valvular heart disease. In fact, many of them come down with that disease and go into heart failure. Well, what Dr. Glickman's theory is that repeated vaccines with these multivalent component vaccines helped bring out that genetic component by causing an antibody response against the heart valves. Now, the studies that he did, unfortunately, weren't carried out further. They weren't found to follow these animals over years, just like was done in the human side of things. It didn't follow the health. All of a sudden, the research stopped. And the next thing I know, I think I remember back at that time, he was on the payroll for a drug company, promoting actually leptospirosis vaccine. So, it's this type of work has been done. It's out there. And we need to be aware of that in our animals.
Is it as controversial to, be pushing back against the amount of vaccines or the size, the dose in veterinary medicine as it is in mainstream medicine, or is there a little bit more of an open dialogue amongst veterinarians in this space?
Most of them are still following the insert on the vaccine.
Okay.
So they're still giving the full dose, even though the study came out that they don't need to give it. And they're still vaccinating every year. 60% of my colleagues vaccinate animals every year, even though the data and the research for over 50 years, Del, has shown that the immunity to core viral vaccines lasts for years, if not the life of the animal. Dr. Ron Schultz, a prestigious immunologist, often considered the father of veterinary immunology, said this 50 years ago and actually published an article in a textbook called Kirk's Current Veterinary Therapy, which was a textbook taught in all veterinary schools at the time. And so he, over the years, has gone out and been an advocate and speaks out and says that our profession is way overdoing it and leading to chronic disease. So, we want to be aware of this type of work that's being done.
Yeah. And so homeopathics, like, is this a branch of veterinary medicine that's becoming more popular? I mean, we had one in California. We found one here in Austin, Texas that does it. So it sounds kind of funny when you first hear it, but,
well, homeopathy is a system of medicine. It's an energy system of medicine that works on a deeper level than even functional medicine does. And by giving diluted remedies that have been potentized, it's called, actually improves the healing of the body, and through the principles of what's called like cures like. So diluted substances that are prepared and shaken down below where there's any molecules there actually have a tremendous healing effect on the body.
And you've seen that. I mean, obviously.
Amazing.
Yeah.
Amazing. That's why, from a homeopathic perspective, these vaccines cause disease well beyond the biochemical aspect of it. It's actually the essence or the energy of the virus that you're injecting. And so you see those energetic changes in the patient, mental, emotional, and then eventually physical symptoms. So it's a chronic effect on the body, and we call that vaccinosis. So, and there are actually homeopathic remedies to counteract that, again, at a deeper energetic level. And so, again, I try and counsel clients to be aware of these things. And there's even homeopathic vaccines that can be used as an alternative to the conventional vaccines. For example, in young puppies that are prone to parvovirus, I actually sometimes will recommend what are called parvonozodes, which is a homeopathic remedy made from diseased material from an animal suffering from parvo. But again, it's prepared and diluted down to where there's nothing physically present, but the energy of the virus at a very dilute level. And by giving that to patients when they're in an age that they're susceptible, you'll actually prevent the disease. So, that's another option instead of giving young dogs parvo vaccine.
Is there, I mean, is that something when you're looking up a veterinarian, do they tend to say they're homeopathic veterinarians? Is that a search term, or how do you find that?
I often tell my clients, the word holistic veterinarian or homeopathic veterinarian means something different to everybody.
Yeah.
And a lot of times people say, well, I do the best of both worlds.
Right.
And they're recommending, let's say, processed prescription foods, or they're giving flea and tick and heavy pesticides to these animals.
Yeah.
And still vaccinating, but they do acupuncture, a little homeopathy, and they call themselves holistic or homeopathic. To me, that's not a true holistic or homeopathic veterinarian.
Great point. Yeah.
So I often tell people there's some excellent websites that they can go to. Like my teacher, Dr. Pitcairn, has an institute called the PIVH, and that has a PIVH.org.
PIVH.org?
Yeah, has a list of veterinarians that were trained in homeopathy, and usually they're going to be more, again, more totally holistic rather than kind of cherry picking.
Right.
So that's the better way to raise animals.
All right. I'm going to ask you a question that's really close to home for me, and that is that, for a while we were making sort of like this all raw. That we had a whole batch of dogs when I, was not nearly as busy as I am now, and my wife and I would grind up the meat and the vegetables and made this like fresh concoction that was really effective. I mean, her daughter was having seizures. The seizures disappeared. I mean, it was really incredible. But we're at a place now where there's just not enough time to do it, and I am spending a fortune on these rolls of pre-made food. And does it make a difference? Just tell me there's a reason I'm spending this much money. Food go to my dog.
Food is medicine.
Yeah.
Hippocrates, the father of medicine, said, let food be thy medicine and medicine thy food. The cornerstone of good health for our animals is a species-appropriate, preferably rotating raw meat protein diet.
Okay.
And when animals are fed that from young ages, we see so much less health problems, less skin and ear allergies, less joint problems, urinary disease, cancer. Their health, their vibrancy, their behavior is just so much superior to animals raised on processed commercial kibble, which is loaded with synthetic ingredients and processed carbohydrates that animals don't really digest very well. So the way to feed them is a raw meat diet.
And you're saying don't stick to the same meat, don't.
Yeah, you want to rotate it.
Okay.
Because what happens is if you and I don't eat the same thing every day, if you feed an animal the same protein every day, they're going to tend to develop an allergy or hypersensitivity to that over time.
Okay.
So the best way to feed them is to rotate those proteins. And when clients tell me that when I change my animal's diet, he gets diarrhea or vomiting or gets a tummy upset, I say, well, you need to see a homeopathic or holistic vet to hopefully help strengthen that gut immune system through nutritional therapies and, again, homeopathic remedies so that he or she can tolerate variation in diet. Okay. So, yeah, raw meat diets are definitely the way to go, Del.
All right.
That and minimal vaccines. When I give lectures and presentations, I tell people if they want to do two things to just improve the health of their animals, it's those two things. And, they live longer. Now, another topic, I don't know if we have some time to talk about, was the idea of removing the sex hormones of our animals.
Oh, yeah, right. Yeah, getting the dog fixed, getting cats.
Right,
yeah.
Right.
Does that has a negative effect too?
Yeah, it actually does. Animals that are neutered or spayed, especially at young ages, the research is now showing that there's a plethora of health problems that these animals develop. Bone and joint problems and certain cancers, hormonal diseases, a lot of them are, and behavioral disorders. People that think that animals that are neutered or spayed have less behavioral issues, well, the incidence of anxieties and aggression and fear actually is higher in the neuter or spayed animal than it is in the non-neuter or spayed animal. So, there's so many benefits to it. And when clients do this, if they do decide to neuter or spay an animal, you want to wait till they're at least sexually mature. So that allows the bones and the joints to mature, because there are so many immune problems that we see of the bones and the joints, like ACL tears, where an animal will tear its ligament. That's an autoimmune disease. It's not an injury.
Wow.
And the lack of sex hormones significantly increases the incidence of autoimmune diseases in our animals. So we want to
Good to
maintain
know.
those sex hormones.
All
A
right.
lot of benefits. The wave of the future is actually now to have what are known as gonad sparing, sexual sterilization of animals. Young veterinarians hopefully will be taught those techniques so that we preserve the sex hormones. So with male dogs, they're going to be doing more vasectomies, and with female dogs, they'll be doing more just removal of the uterus and sparing the ovaries. Just like with people, when you remove sex hormones, right? There's all sorts of health issues that crop up throughout the body. The hormonal systems of the body work together. They don't work in isolation. So you take the sex hormones out, you affect the thyroid, the adrenal, the pituitary. It's all an integrated system. So that's why we want to be mindful of removing those sex hormones too. So, my take-home points for a healthier animal are less vaccines, species-appropriate raw meat diets if possible, although my colleagues who preach vegetarian diets will bicker with me, but and that's for different reasons. But a species-appropriate diet, minimal vaccines, and less flea and tick and pesticide medications and overworming, which also stress the immune system and are toxic on the body. We cut it down on a lot of those, and we have healthier animals. And there are herbal alternatives to a lot of these things, and essential oils that can be used for flea and tick prevention. There's herbal remedies that are good for heartworm disease. So I try and, again, recommend these to my clients. And a less is more approach when it comes to the conventional drugs.
Fantastic, Dr. Dim. That was a ton of information. People hope they had their notebooks out because really, really great. And I know we answered a lot of questions coming in. I want to thank you.
Oh, I love it.